Good morning and welcome to Policy Exchange. It's a huge pleasure to have Diane back here again at Policy Exchange. The last time she was here, she was one of the leadership candidates in Labour's leadership election. This time she is back as Shadow Minister for Public Health. Now, some of you may have seen her in the papers in the last couple of days saying some really interesting things about what she called muck parenting. And in one of the papers she was talking about children who get chicken and chips every evening, about the little boy in his room surfing the dark corners of the internet. That is something, parenting and childcare, that we've become very interested in at Policy Exchange as well. We've been thinking we're about to publish on childcare, hopefully we're about to start a project on Sure Start. And I've been writing recently about the way that rich and poor children are increasingly living not just in different economic worlds, but in different social worlds too, being treated very differently by their parents. Now, Diane has an incredible wealth of experience. She's been so many different things in her career. I'm not going to list them all, but she's been, amongst other things, a civil servant, a civil liberties campaigner, a TV journalist, and the first black woman in Parliament. Two things I didn't know about her before I started looking were that she's also the founder of the London Schools and the Black Child Initiative, which is about trying to improve educational achievement among black children. And also that in Hackney North and Stoke Newington, in her constituency in the last general election, even though it wasn't, in fairness, the best election for the Labour Party, she actually managed to double her majority on increased turnout. She's obviously doing something right down there. And today it's a particular pleasure to have her here. You'll all realise, those of you who are political nerds, flying solo rather than crammed onto a sofa, as we normally see you with Michael Portillo and Andrew Neil. Probably a relief for you too as well. So, a huge pleasure to have you here, Diane. Thank you for coming this morning.
Well, good morning. It's a tremendous pleasure to be back here at the Policy Exchange in front of the great and the good. And I'd like to thank Neil and Harriet for inviting me. My speech this morning is about putting the family front and centre of public health policy, in particular when it comes to children. And I want to make clear today my resolute belief about the importance of strengthening families, social networks and communities as part of our mission to improve British public health and to improve the health of British children. But let me begin by saying that I do believe in the role of the state. I believe in the enabling state. I am, in fact, a product of the enabling state, from the state issues cod liver oil and orange juice that I had as a child, to the fact that I was privileged to have what I still believe was the finest education money could buy, completely free. First at a state grammar school, which happens to have been the sister school to a boys' grammar school, attended in the same year as me by, amongst others, the barrister and TV presenter Clive Anderson, our distinguished ambassador in Washington, Sir Nigel Sheinwald, and last but not least, the one and only Michael Portillo. You could say that year was a vintage year for both Harrow County Grammar School for girls and Harrow County Grammar School for boys. And of course I went on from my entirely free state-enabled grammar school to an entirely free state-enabled education at Newnham College, Cambridge. I am not in the business of pulling up the ladder behind me. So I say to you all clearly, for the avoidance of doubt, I believe in the enabling state. I also believe that the balance that this government has sought to strike between personal responsibility and the role of the state, the so-called debate about the nanny state, I believe that in trying to strike a balance, I worry the government is coming down too heavily on the wrong side of the scales. The personal responsibility narrative can mean to some of us actually coming down on the side of multinational corporations, the big retail chains and fast food conglomerates, rather than holding the ring between them and British families. The government is not recognising that some people just do not have the social capital to exercise choice in the way that Andrew Lansley, David Cameron, and perhaps a policy exchange would like them to do. Too many people in communities like mine do not have access to a computer to find the information and stats and reports from think tanks that people would like them to. Too many people up and down the country live in fresh foods deserts where it's easier to place a bet or buy chicken and chips, the chicken often of dubious provenance, than it is to buy good quality fruit and vegetables. Too many people genuinely want to do the best for their children, but are struggling against a tide of junk information about junk food, where billions is spent on newspaper ads, television, and increasingly online marketing, but it's billions spent on the most unhealthy foods. I believe that the government's personal responsibility mantra is particularly inappropriate when it comes to children, because children are simply not in a position to make personal choices. So if you want Britain's children to have good health outcomes, the state has to step in to make it easier for parents to make the right decisions. I do not believe that in the 21st century, families will flourish if the state simply steps back. And let me, before moving on to public health issues more generally, cite an example where the government is in danger of being unduly swayed by the arguments about parental responsibility. And this is the issue about online porn. I'd like to take the opportunity to give credit to Claire Perry and other MPs in all parties who've led the fight to make porn an opt-in option for families rather than requiring them to opt out. It is well and good for the industry to be on television, to be on radio, saying, well, it wouldn't necessarily work, it wouldn't really catch all the porn. You know, parents have to exercise personal responsibility. But even if the move to making porn an opt-in option rather than opt-out, so you have to make decisions to opt out rather than it coming down the internet at you, even if it protected most children from most porn online, I believe, and the Labour Party believes, it would be a good thing. Because we're not talking about ladies with naked breasts. We're talking about degrading and demeaning and dehumanising images, the like of which, when I was a teenager, you couldn't even buy from the top shelf of a newsagent, assuming the newsagent would sell it to you. And children as young as who are old enough to press the button on a computer can access that porn. And so I think the online porn issue illustrates the danger of having a default which is about personal responsibility and not about what is good for families. So I've established where I stand on the state. I also, I think, need to define my position on the family. Now, the family is an issue which, in my view, too much cant, to use a Victorian word, is spoken. I particularly dislike the phrase, which is popular in all political parties, about hard-working families. I always think, well, what happened to the children of lazy families? Are those children just to be abandoned? Something about that phrase which always put me off, whether it's coming from Tony Blair or David Cameron. The first thing to say about my views on the family is that I am a feminist. I'm proud to say it. I read the books, I went on the marches, I've got the T-shirts and the dungarees hanging in the back of my wardrobe to prove it. And like many women in public life today, particularly on the centre-left, I came of age in the 80s during the high tide of the feminist movement. And I have to say, although I am happy to stand by and still support the classic feminist agenda of women's personal autonomy, a right to choose, and equality in the workplace, it is a fact that some feminist rhetoric at the flood tide of feminism in the 80s was not always entirely positive about the family. The family as a site of women's oppression is a phrase I seem to remember in a number of articles and books. And I think that that ideological debate has led some of us on the centre-left with a certain ambivalence about talking about the family. So much so that I am concerned that the left has abandoned the issue of the family and abandoned the debate around the family to the right in politics. And I'm here this morning to reclaim issues about family and community and kinship ties for the left, centre-left of politics. But the other thing to say about the family and my perspective on the family is the reason I feel so strongly about the family is that I am the child of immigrants. And first-generation immigrants always feel passionately about the family. It doesn't matter whether they're Jamaican, Nigerian, Jewish, Irish, Bangladeshi, Vietnamese. They always feel passionately about the family. And what is that? It's not mere sentiment. It's because when you're a first-generation immigrant, fleeing hardship, coming to a background of incredible insecurity, family is all you have. When people from the West Indies came here in the 60s and 70s and they wanted somewhere to live, they didn't go to the housing office. They went and stayed with family members. When they wanted to find somewhere to work, they didn't go to a connections office or go and ask their social worker. By and large, they went to the workplaces, the factories, the workshops, the hospitals where family members worked. I've been to the funerals of Jamaican men who've passed away in the last few years and heard very touching stories about how they arrived in England and next day they were at their friend's factory and had found a job. And when West Indians came here in the 60s and 70s, if they wanted to save, to buy a house, they didn't go to a building society, they didn't go to a bank. They did a thing, which none of you will have heard of, and you call it throwing your partner. Don't ask me why it's called that or what exactly that means. But what it is, it's a form of saving where a group of people who almost invariably come from the same district or part of the same kinship network come to an agreement to save the same sum of money every week. And in sequence, one of the members of that saving network gets the pot. There is no legal paperwork. There's no paperwork of any description. Throwing your partner depended absolutely on trust and kinship networks. But it's through that form of saving that a whole generation of West Indians were able to put together the deposit to buy their homes in the Hackneys, the Brixtons, and inner city areas around London. And finally, if you were a first-generation Jamaican immigrant, you came here in the 60s and 70s, if you wanted health advice, you tended to look to your family. And, you know, doctors in the audience would be shocked to know that I myself, a highly sophisticated second-generation Jamaican immigrant, diligently drank Guinness throughout my pregnancy because I understood from childhood that is what pregnant women drank. So the reason immigrants are passionate about family, whenever, in the first generation, most certainly, wherever they come from, whatever part of the world they come from, almost whatever their social status, is because when you are a first-generation immigrant, family is all you have, and you regard it with a passion and a concern which lasts generation after generation. But the other thing I want to say about families, before I move into the body of my speech, that it's very important that we don't use the word and the phrase family as a code for a man and woman living in Middle England with 2.2 children. I think that policymakers and think tanks have to face up to the fact that in the 21st century, families in Britain come in all shapes and sizes. There are nuclear families, there are extended families. There are two parents, there are single parents. There are parents where one is a man and one is a woman, and there are same-sex couples who have children and a family. Nothing could be more calculated to undermine the case for family and community and kinship networks if people are able to assume that when you say family, you're talking about something which they can't relate to, that is not the reality in particular of living in 21st century urban Britain. So having spelt out my belief in the role of the enabling state, what exactly makes up my interest and concern for the family? Let me talk now about public health issues and children and the family. And let me start by talking about the issue of children and mental health. Now, this is an issue that the Labour Health team, led by Andy Burnham, who was Secretary of State for Health, mental health is an issue we are particularly interested in because we concede we could have done more about mental health in government. And the facts about children and mental health is that 3 children in every classroom has a diagnosable mental health disorder. 1 in 5 adults shows signs of an eating disorder. 1 in 12 children deliberately harm themselves. 25,000 of them are hospitalised every year because of this, and there is anecdotal evidence of a rising trend. And nearly 80,000 children and young people suffer from severe depression. And let me pause here and talk about the ongoing scandal of the grooming of children in North of England towns like Rochdale. There has been endless debate about the racial and cultural aspects of this. There has been endless debate about how social workers and children's homes failed those children. But that, in my view, there's not been enough debate why these young girls, who were children, went back and back, time and again, to be abused, why their self-esteem was so low that they were literally, quite literally, in very many cases, willing to sell sex for a bag of chips. These are issues about the mental state, about depression, about hopelessness amongst our young people. And the answer to public health issues and mental health around children is not personal responsibility. The problem for those children that were being groomed and lured and then subjected to weeks and months and years in some case of rape and battery, the problem, personal responsibility would not have helped them. And I have to say here, and I'm trying to make a speech which is not, unnecessarily party political, I am very concerned that the changes in the health service that come with the new NHS bill could make matters in relation to children and mental health harder. We're already seeing cuts in the kind of non-statutory services that councils are used to provide in schools to help identify mental health problems. Mental health professionals, and I've had a series of roundtables throughout the past year talking to professionals, are concerned that potentially the split in service provision between local authorities, directors of public health and clinical commissioning groups will mean a fragmentation of services. Last year, I visited an excellent purpose-built mental health facility for children in the East End, which is seeing rising need, but is worried about its future under the new arrangements. But having said there's a role for the state, having said that we need to be very careful that the new arrangements for public health under the new legislation don't impact adversely on children and mental health, you cannot deal with children and mental health family issues without working with families. We need to look at talking therapies that engage the whole family. It's too easy for GPs to hand out drugs. We need to look at working with families, with talking therapies, and we also need to look at tailoring the work to different communities. But families, I believe, whether they are nuclear families, extended families, single-sex families, families are part of the solution to engaging with what I believe is a growing problem in relation to children and mental health. I want to move on to a childhood public health issue which has been well aired in recent times, and that is childhood obesity. Now, the national stats for childhood obesity are very alarming. In 2010 to 2011, 1 in 10 children in reception class, that's 4 to 5 years, were classified as obese. And this rises to a fifth of pupils by the age 11. Now, when I was a child, and you were a bit chubby, people said, oh, well, you'll grow out of it. But now we know, in the 21st century, overweight children become overweight adults with spiraling levels of diabetes. 1/6 of the drug bill of the NHS goes on pills for diabetes. And diabetes, hypertension, and even cancer. 40% of cancers are caused by lifestyle issues, overweight, drink, tobacco, and many of those poor public health issues start in childhood. 70% of 10 to 14-year-olds who are obese now will remain so through adulthood. That is why dealing with the childhood obesity epidemic is so important. This is the fattest generation of children ever. And once upon a time, malnutrition and rickets were the diseases of poverty, but for too many children in the 21st century, tragically, in Britain and North America, obesity is. And of course, tackling childhood obesity is not about personal responsibility of the children as such. We are seeing billions spent on advertising processed food and fast foods specifically to children. And I have to remind this audience that the new academies that the government is so proud of, we find in those new academies, because they're not subject to the same regulation as mainstream state schools, that 9 out of 10 of them have junk food, fizzy drinks and sweets on sale, which is something that is now banned in mainstream state schools. So in the name of letting 1,000 flowers bloom in education, you're going backwards on some basic public health advantages which people fought for. And when I have gone around the country looking at effective programs to tackle childhood obesity, the best ones have always involved the patients, the parents. I remember a program in Tower Hamlets that I visited. It was called the MEND program, and they did good work, working not just with the child, but having the parents come into school with the child for advice, for lessons, for support. The other public health issue in relation to children that I want to touch on is encouraging active lifestyles. Now, we all know, we all should know, that this is the most sedentary generation of children ever. And there are a number of reasons why children nowadays are more sedentary. There's the issue of stranger danger, that people are terrified of letting their children play on the streets because they're frightened of strangers kidnapping them. When I was a child, I wasn't a particularly sporty child, I have to admit, but when I was a child, in the summer holidays, I'd have my breakfast and I'd be playing out all day, up and down the alleys, the park, playing with the other children on the street, and didn't come home. I might come home for lunch, or I might have lunch with a friend, but didn't come home properly till tea time. My mother didn't worry. She didn't think anything of it. No mother in London, for sure, would let their child play out for hours at a time and not know where they are. That is the stranger danger phenomenon. We've also seen the rise of home-based entertainment for children, television, computer games, home computers, tablet computers, and too many parents that want to do the right thing, think they are being good parents by keeping their children safe inside. It's a particular problem for girls, the research shows, because they're less likely to play active sports and quicker to decide they don't want the embarrassment of being seen in gym clothes. But we know research shows that inactivity and weight gain form a vicious spiral. Some experts argue it's not so much the inactivity that causes weight gain, but that children, when they're overweight, are reluctant to take exercise. But whatever the causality, childhood inactivity and childhood obesity feed on each other. So the state has a role to play in building playgrounds, encouraging school sports, and in particular, encouraging varied activities like ice skating and dance, which are more likely to lure girls into becoming physically active. But I'm not convinced by some of those in the children's play industry who say that the main answer is more and better children's recreation facilities. In Hackney, the local authority and social housing providers have been painstaking in building playgrounds and little play spaces for toddlers in almost every new housing development. The play industry would say, build it and they will come. But all too often, as I walk around Hackney, I don't drive, I walk and take public transport, you can see play places empty, play places for toddlers empty in the daytime when the sun is shining bright, play spaces after school in the daytime, if not empty, full of children who I can see with my eyes, my own eyes, do not represent a cross-section of the demographic of poor children in Hackney. It is not enough to say, build it and they will come. We have to work with families. We have to get the message out to parents about the importance of physical exercise for children. They have to understand the importance of play. Finally, I want to talk about children and alcohol. I've been up and down the country looking at the issue of alcohol as part of my public health responsibilities. And one of the things I found is specialist doctors telling me that where once upon a time it was very, very rare to have to pump out the stomach because of alcohol abuse of children as young as 12, they are now pumping out the stomachs of 12-year-olds once a month, once a week. They are, when you go to hospitals and consultants that specialise in issues in relation to alcohol, they are telling you of younger and younger children coming forward with the symptoms of alcohol abuse. We've seen the rise of the alcopop. Probably most of us here wouldn't drink an alcopop. Quite right too, because actually alcopops were devised and marketed to appeal to the sweet tooth of underage drinkers. And I want to say at this point that the Labour Party supports minimum pricing for alcohol. That's the official Labour Party position. We have not yet arrived at a figure, but my personal view is we're going to have to match the figure in Scotland, otherwise you're going to have, smuggling across the border. And minimum pricing, and I'm happy to have a broader debate if people want it, minimum pricing is particularly important in relation to underage children and alcohol abuse, because there is no question that as alcohol, the price of alcohol has fallen to pocket money prices, underage children are drinking more and more alcohol, and teachers say, where once upon a time, adolescents would save up their pennies and get drunk on Saturday or weekend, children are binging midweek because actually they can afford it. Children and alcohol, it seems to me, is a clear issue where government action is needed, cannot just be left to personal choice, but it's yet another issue you cannot begin to tackle without involving families. And I would say that part of the British promise that Ed Miliband has spoken about must be the expectation that children will enjoy greater health and well-being than their parents, but instead there's a very real danger that numbers of today's children will live shorter lives than their parents and spend more of their years in poor health. Indeed, I would contend the health of Britain's children is now coming to the point where it's a national emergency. But instead of the engaged parenting we need to tackle these issues, we have seen the rise of what I like to call muck parenting. Now, full disclosure, since I took the job of Shadow Public Health Minister, I think it's fair to say I haven't been McDonald's closest Westminster ally. I've warned about the dangers of being children left to grab chips and Coke to and from school for breakfast and dinner. I've warned about putting big business in charge of public health via Andrew Lansley's responsibility deals. And I've pointed out that the world's largest McDonald's is being plonked in the middle of the Olympic Park. The so-called healthy games are going to host the largest McDonald's in the world. But what I want to warn about today is the rise of what I call McParenting. McParenting isn't about any one class or community. It's about parents who substitute things for parental responsibility. Children who get a chicken and chips for dinner from a takeaway more often than they sit down to a family meal. Children for whom fast food is not a treat but a dietary staple. Boys in their room on their own, out of their children's hair, but allowed to surf the dark corners of the internet hour after hour without supervision. Children who are bombarded with the latest gadgets, the latest smartphone, the latest computer game, rather than having their parents pay them some attention. My son went to a primary school on the border of Hackney and Islington, and very often, taking him home on the bus, I would see children with their mother beside me. Those children, these are children now between the ages of 5 and 11, were top to toe in designer clothes, top to toe. And my son was deeply envious. He used to complain that I wouldn't buy him designer trainers to wear to school. He thought I was, unnaturally cruel and unfair. But the children would be there, top to toe in designer wear, but their parents weren't talking to them at the bus stop waiting for the bus. The parents weren't paying them any attention. The parents weren't asking them how their day was in school. So the children had the designer stuff, often bought by young women, without anything like the income that I had, but they weren't getting what they needed more than the latest trainers with the latest logo. Actually sustained parental attention. And I was shocked years ago to go into primary schools in Hackney and ask teachers teaching reception what were the problems they were facing. And they started to tell me that one of the problems they were facing was children that hadn't been spoken to. They weren't spoken to at home. Their parents were listening to their iPhone or watching television. The children weren't used to being spoken to. And I have to tell you, I was shocked. I was brought up in a West Indian working class family where people spoke to you all the time. In fact, your complaint was people never stopped speaking to you. And so the idea that there's a phenomenon now in working class communities, children growing up without that attention, without that conversation, without learning the skill set which comes from interacting with adults is quite alarming. And of course, it affects their education. Parenting is about the mother whose default position is to go up to the school and abuse the teachers, rather than just turning off the television once in a while. It's about parents who believe parenting is about things, McDonald's, tuition fees, new video games, rather than actual parental engagement. But parenting is a problem in every class and every community. I want to touch on how we got there. I think that it's accurate to say that individualism and materialism has become dominant in the culture of the time. And although there's unquestionable benefits from this, it's left too little space for family and community. We, as a Labour Party, thought it was important to break with the constraints of conservative family norms, to escape the looming and stifling clouds of tradition and collective conformism. And it was an argument we were right to win. We were brave and bold. Civil partnerships, 2 weeks paid paternity leave, free nursery places. We fought for that progress. But it left us as a Labour Party with too little to say about the family. And I believe with the financial crash we're seeing across the world, with Britain's spiralling debt and jobs crisis, with issues like the disorder that I saw in my constituency in Hackney last summer, it is time once again for the centre-left to address itself to issues about family and community. Families will go on evolving, but it's still the case that for the better society, all sides of the political debate need to engage around issues in relation to the family. We already expect our teachers to be social workers, child psychologists, nutrition, child protection officers. We expect them to police the classroom, take care of our children's health, counsel our sons and daughters, guide them, worry about them, and on top of that, educate them. But as President Obama said, government can't read to your kids at night or turn off the TV. The final thing I want to say about families is this, that unlike the argument you'll hear from some quarters, I believe that modern families are the victim not of the overbearing state, but of the overbearing market. And by that I mean the young mother who sees expensive television ads every evening for milk formula, but sees no such television advertising for the benefits of breastfeeding, the insistence of marketing men that good, loving parenting is to be equated with a certain brand of gravy powder, expensive processed food, and all too easily available fast food. The millions spent marketing Alco-Pops, which were deliberately targeted underage drinkers. The business fight back we can see today against restriction on porn on the internet. It cannot be right that by the age of 10, the average British child recognises more than 400 brand names. The modern child knows more brand names than they know the words of nursery rhymes. That is a testimony to the effect of the overweening market on British family life. I believe government can make a positive difference to the life of families, protecting them from overbearing markets in the face of industry intransigent or worse, in order that healthier food choices are easier for parents to make. Now, what are the policy implications from everything I've said? Well, the Labour Party is in the throes of a policy review, but let me tell you some of the policy issues which I believe that we should look at. First of all, there's the issue of clear and consistent labelling of products in stores. You really cannot expect busy mothers to pick up a pack and say, oh, 102 calories per ounce, 4 ounces in a serving. I mean, they're not going to do that. The advantage of traffic light labelling, and why actually fast-seeing retailers like Sainsbury's have adopted it, is it's very easy, whatever your level of literacy, whether or not English is your first language, to pick up a pack and see whether something is healthy or not. We need to look at doing more to support families in teaching young people practical cooking skills. I have to say that one of the things I learnt at my grammar school, apart from Latin and history and maths and science and physics, and I have to tell you that I got A in all of them, but I also learned something of lasting value, how to make pastry and how to make an apple pie. Not that many children leave school nowadays knowing how to make pastry. I think we need to revisit the importance of practical cooking skills. We need to look at making it easier for all children and their parents to get outdoors. We need to change the law to stop the marketing of sweets and junk foods online to children. If you go online, and the Children's Food Campaign's done excellent work on this, you can see site after site using cartoons deliberately targeted at children, marketing junk foods, which they would not be allowed to market on television before children have gone to bed. The government needs to stop the undermining of food standards in academies and make the regulations that apply to food quality in school lunches and to having fizzy drinks and sweet machines on the premises, make those regulations apply to academies. We also, in my view, need to look at making public health a planning criteria. Because if public health was a planning criteria, local authorities would be able to do something about the proliferation of fast food outlets that you see around our schools. But finally, let me say this. There is work to be done, and the party's in the midst of a policy review doing that work, to look at exactly the right policy proposals to achieve the ends I have outlined today. But the message I have for you this morning is that the centre-left needs to reclaim the debate about family, that we need to put the health of our children at the heart of the public health debate, that in fact the health of our children is a touchstone as to whether any government has got it right as between personal responsibility and the enabling state, and that public health, the issues raised by public health, be it mental health, be it obesity, be it alcohol, being an active lifestyle, are actually at the heart of a health service which can lead to healthier outcomes for British people, which can lead to containing costs, and can lead to the fulfilment of the British promise that for every generation there should be more hope, more opportunity, more possibilities than the present generation. Thank you very much for inviting me to speak. Thank you very much for listening so patiently.
So we now have a little bit of time for some questions and answers. Always a pleasure to listen to Dan speaking. So many questions it raises. First, at the back of the room, Mike will come to you. If you can say who you are and where you're from, that'd be helpful. Then we're going to come to these two gentlemen here.
I don't think it's on. Maybe it is.
Yeah, yes.
Simon Hill from Cerner. Diane, thank you very much indeed. Very interesting talk. A lot of the things that you talked around about public health stem from mental health issues. Currently, we spend about £10 billion a year on mental health. And just to put that into context, we spend about £7 billion a year on cardiovascular and £5 billion on cancer. Do we need to spend more money on mental health, or do we need to do something different?
Let's take them in groups. And there's a gentleman who was here, actually, the third row, and then we'll take a third question in this bunch. The gentleman in the brown jacket.
Hi, I'm Angel Bacter from Fleischmann Hillard. A lot of the policy implications you mentioned regarded more public sphere things, so how to change schools, how to reduce junk food in academies, cooking classes, and so on, and clear labelling. How would you tackle the more private sphere, what's happening in families? How would you get the parents to switch off the television to stop their children being cooped up in front of a computer, which you seem to suggest is the very core of the problem? Thank you.
Good question. And then, third gentleman.
Hello, Asa Bennett from the Huffington Post. I was just wondering, on the topic of mental health and children, to ask about Jo Swinson and her campaign for body image, and what your stance was on that.
Okay, on the question of body image, I support that campaign, but I also think it's part of a wider problem of sexualisation of young girls. I, as a card-carrying feminist, was speaking at a pro-choice rally yesterday. But actually, in common with the right of politics, I deplore the rise of teenage pregnancy. I deplore the sexualisation of young girls. But I don't think that denying them the right to choose is the answer. I do think we have to look at the imagery that they're bombarded with in the media, and we have to look at the education and the activities and the opportunities to build their sense of self-worth that currently many of these young girls are lacking. On the question of mental health, I don't think necessarily in the long run we need to spend more, but I do think we need to spend it differently. Why I was keen to talk about children and mental health, because most children who even get diagnosed as a mental health problem do not get the appropriate treatment. And I believe that if more was done around children and public health, if more was done about increasing family resilience, in the long run, you would save money on treating adults who have full-blown mental health issues. As somebody asked about, the role of the state and the role of the family. Actually, the speech was all about the role of the family. And I believe the first step in getting this issue on the agenda for families is for people like me to begin talking about it, begin making the case that it isn't all about the state, it isn't all about government, it's about what you as a family can do. And we know that we can change attitudes within families on public health issues. When my son was at primary school, and it was an inner city primary school, he would run home most days after particular classes and tell me what a terrible thing smoking was. He does not smoke. Diminishing numbers of young people are smoking. It's taken almost a generation to change attitudes, people's attitudes around smoking. I believe that with a combination of state action, exhortation, campaigns, we can also change attitudes in families to issues like mental health, activity, and diet. So I think, first of all, we need to change the debate and make the role of families a central part of the debate, not just on the right, but on the centre, left and left. And secondly, we need to look at where we have successfully changed people's thinking about public health and follow that model.
Very good. Now we're going to start with the lady who's in the very back row. Now we come to the lady in the very front row, and then probably the lady in the scarf.
Fiona Cuthbertson from Keystone Consulting. Those children with mental health issues are often excluded from mainstream education. How can we make sure that they actually get the education they need, both academically and for life skills, through public health and education provision?
Deirdre Boyd, Addiction Recovery Foundation. Deirdre Boyd, Addiction Recovery Foundation. I'm actually going to see you next week when you're visiting our women's rehab in Streatham. And I just wanted to bring that up because that's about breaking the generational chain. And I'd like to link something you said at the beginning with something you ended up at your speech, which is the lack of esteem in children, the lack of hope, and then parents talking to the children. And you left out drugs. Yeah. But linking that to all the other behaviours, parents talking to their children means that children start experimenting far later, which means there are far less problems. And it does link into that. It links into schools, it links into life skills, it links into being outdoors, it links into children, those who don't like sports, but all of them going out into nature, which doesn't happen. And that, again, is recreated in rehabs when people are adults and they go back and learn the things that in a healthy family you would have learned as a child. And I just think when you're visiting the women next week, it might be interesting to see what they learn in rehab that brings them back to become a healthy human being, that breaks that intergenerational chain and will bring their children up in the healthy way that you are desiring at this moment in time.
Interesting point. And then the lady in the knitted scarf.
Samantha Callan, the Centre for Social Justice. Dan, loved hearing your passion on the family, which I share. And I've just finished a mental health review, and we found the family was absolutely at the heart of solutions, often complicating the problems, but no reason to sideline. But one area I'd be very interested in hearing your thoughts. We found in our polling, half of those polled thought family breakdown was a major contributor to poor mental health. Perhaps slightly more robust research, Institute of Psychiatry research found that family breakdown and separation really quite key in the high rates of psychosis that were found in black and minority ethnic communities. And also one more piece of research, the social exclusion unit, early noughties. You talk very movingly about teenage girls in Rochdale, what is at the heart of that lack of self-esteem. And the social exclusion unit fingered the lack of fathers in children's lives. And I'm so encouraged that the Labour Party is moving into this space, but I'd really like to know what you feel we can do to tackle this huge problem of family breakdown and fatherlessness.
Okay, I'm looking forward to coming to Streatham to see your rehab centre. Well, the rehab centre you were talking about. And I think, you know, and it's interesting that you say that this issue about just communicating actually runs through the issues these women have. And I will be very interested to ask them what they have learnt in rehab, which enable them to go back to their families and, you know, stop that intergenerational thing about lack of communication and poor esteem and not having social skills. On the question of exclusions, exclusion is something I'm very interested in. I've long taken an interest in why working class boys fail in school, and in particular why black boys fail in school. And whilst I'm very clear that there are children whose behaviour is so poor that actually, for the benefit of the classroom and the school, they need to be excluded from the mainstream classroom, what I don't think we should be doing is dumping children in people referral units where the only avenue forward is an avenue which leads to a career in crime. It was sorry.
I also meant with respect to they might be excluded because of mental health.
Sure, well, let me... Yeah, no, I understand. But I wanted to make this point about exclusion because you asked me about something which I really care about. And I think it's important to understand about exclusion. Martin Neri, who was a one-time Director General of the Prison Service, and then was a director of Barnardo's, Martin Neri said years ago, on the day you give a child permanent exclusion from school, you might as well give them a date and time to turn up at prison. That is the connection between school exclusions and a life of crime. And of course, many of those people, when they come into the prison system, have mental health difficulties, very often undiagnosed mental health difficulties. Rather than just dumping children in people referral units and thinking that you've got them out of the system and they're no longer a problem, I think we need to look at what happens to children that have to be excluded from mainstream classrooms. We have to give them, if anything, more resources and more effort and more intention. And you do need to focus on their mental health issues. I think that's quite right. Finally, family breakdown. Yeah. I mean, I'm a real proponent of different models of families. And it comes back to my background, actually. And on the one hand, my paternal mother and father were happily married, and married for, must have been 60 years, because they married as teenagers. But my maternal grandmother, Miss Di, I was thinking about Miss Di this morning when I was drafting this speech. Miss Di had 7 children, I think it was 4 different men. But you know something, by the time I knew Miss Di, she was a pillar of her community. She had the most cohesive family you could imagine. All of her children, even though some of them had different fathers, were very, very close. And when she died, she had a massive funeral. It would have stretched from Storey's Gate to the House of Commons. And I thought on the day of her funeral, if I can have a funeral of this size, with so many people love me, then I'll have done something with my life. So I believe that the fact that you don't have a piece of paper saying you're married, and the fact that you don't have 2 parents doesn't necessarily mean that you're going to have a less stable family. But whatever your family model is, whether it's a nuclear family or an extended family, if that family becomes unstable, if that family breaks down, that does create uncertainty and unhappiness in children. And the other thing I would say is that all too often, family breakdown is allied to underlying economic issues. When we had higher levels of employment in some of our inner city and working class communities, you did not see the levels of family breakdown you see today. And I think part of that is that for better or worse, there was a generation of working class males, whatever their colour, who defined themselves by being able to provide for their families. And once changes in the economy, in the world, the move from Britain from manufacturing to service industry, deprived many of them of a means of caring for their family, then somehow it kind of broke the bonds. And you see the family breakdown you see today. I like to remind people that the gangsters and the gang members you see in areas like Brent in London are actually the grandchildren of men who came to this country in the 50s and 60s and worked hard all their lives, but were able to do that without certificates because of the kind of economy we had then. And what I would say to you, I think family breakdown is an issue, but we have to tackle it alongside with offering people economic security and a means of providing for their family. But it's an interesting issue. I'm sure we'll return to it.
Another round. We're going to go to the gentleman in the second row here, and then there's the lady and gentleman in that row there.
Bruce Malevra, the Tavistock Centre for Couple Relationships. By way of introduction, we do counselling, psychotherapy. People have heard of us and relate in organisations like that. Does the enabling state that you espouse, will it continue to support and encourage organisations like ours who are there to help unhappy, dysfunctional parents, not only with issues between themselves, but with issues relating to their children? Thank you.
Gentleman on the end of that row there.
Thank you. David Bertram, UK Consulting. You mentioned that we should learn from the success of the campaign against cigarettes and tobacco, particularly in the context of your son, and I think many of us were, being educated about the evils of tobacco and how damaging it was. But the success against tobacco has come through many other ways. Tax increases, changing the nature of the product, getting it out of advertising and promotion, and the smoking ban. Now, I don't think you can be suggesting that we have to involve all of those other methods against food and alcohol as well, but will education be enough, or should we also be pursuing some of those techniques against the food and the alcohol industries? Thank you.
Interesting question. And then I think there's a lady in the same room.
Sophie Kidd from Addiction. We're a drug and alcohol treatment charity. Amongst others, we're massive advocates of family-based work, and we do a lot of it ourselves. And the problem is commissioning these kinds of services. The whole country there's lots of pockets where there's brilliant family work being done, but how do we actually get it embedded into commissioning?
Okay, on the question of the Tavistock Clinic, everyone's heard of the Tavistock Clinic. It's done path-breaking work in terms of this sort of counselling. But as to whether you will receive the support and funding to go forward and expand your work, I have to say with all due respect, that's not a matter for me. That is a member for the current government. If it was a Labour government, I could assure you of it. But, you know, voting has consequences, and we now have a coalition government. On the question of smoking as a model for changing attitudes to public health, I'm sorry, my anxiety to get to the end of my speech, because I think I was running slightly longer than the chair expected. Perhaps didn't make myself clear. What I'm saying is that, number one, you can change attitudes within families to public health issues. And smoking is a model because smoking took a range of levers to do it, both changing the law, smoking bans, advertising. That's what I really meant. The point about smoking, to me, is it proves it can be done, but it also proves it takes a range of policy levers and advocacy levers to do it. That's all that I meant. And the point about action, well, this is going to be very difficult, because the changes in the NHS bill, and actually, in principle, I support giving local authorities more power over public health and more localism. The changes, though, mean that you actually having to embed these services one by one in different local authorities. And it's not at all clear that every local authority will feel obliged to use the services that organisations like Addiction offer, but it's very important they do. And that's why I'm trying to get this message out this morning and going forward about the importance of working with families, and that actually working with families around mental health issues and addiction issues actually saves money in the long run.
Very interesting. Just on this question about price, if I can just push you a little bit further on that, and the analogy with smoking. So in smoking there was education programs, there was attempts to use tax to increase the price. There were display bans and advertising bans, and then there was the smoking in public places ban. So if we think about that as an analogue of junk food, are you interested in using price, sale bans and advertising bans? Are those things that you're thinking about at the moment?
Well, I think in relation to junk food, I think there are two things. It's what happens when the children are at school. That's why I stress the importance of rolling out the regulations that apply within state schools around vending machines with junk food and the nutritional quality of school foods to the burgeoning academy programme. I think it's advertising to young people, and it's getting information to parents. I believe with food in particular, because I think the mix of emotional issues around what we eat and when we eat it and why we eat it is perhaps a little more complex than alcohol. I think with food in particular, going straight to price mechanisms and taxation would probably be a mistake. I think we need to explore what happens with young people, with children in school, with children in nursery, and with education before we look at those issues. Although it is the case that over overseas, more and more people are coming around to looking at fiscal measures to address issues about food and junk food.
Interesting, sorry. There was a very patient gentleman in a purple tie in the front row, and then there was a gentleman in a blue shirt right at the back. Sorry, I'm making me chat with the microphone and walk backwards and forwards all the time.
Chris Jenner from BD Becton Dickinson. I was interested to hear, or sorry, lack of hear, of the mention about sexual health in your speech. It's not just you, it seems to be a general comment about children as they grow up in particular. It's a very important part which seems to always be kind of swept away. I'd be keen to hear what your thoughts are in particular about that in policy making as you go forward.
Blue shirt.
Thank you. John Chisholm from Concordia Health and the Royal GPs. You touched a little bit on teachers' roles and responsibilities, and I wondered if you might say a little bit more about the role of education in schools, and particularly PSHE education, and the possibility of including in the national curriculum more requirement for health education about lifestyle, about managing minor ailments, potentially about making sensible choices and using the NHS in a better way. I think there's a possibility for teachers and children and parents to work together in order to produce healthier outcomes for the next generation. And I wondered if you thought that some sort of national decision to beef up health education in schools would be helpful.
Yep. Get on with there. Actually, we'll take a gentleman in the purple shirt.
Hi there, Kevin Golding-Williams from Living Streets. Just picking up the first point around childhood obesity and active lifestyles. Next week is actually our National Walk to School Week, so hopefully Diane will endorse that. My question is really on the policy review. Public health interrelates with so many other aspects of policy. I just wonder how you plan to get public health almost as a golden thread across other departments such as DCLG, transport and education.
Okay, well, on the policy review, I should say that I am responsible, certainly, for drawing up the initial policies in relation to public health, and will be doing so over the next 12 months. And it's absolutely clear to me, from the work I've done, the people I've spoken to going out of London and talking to people working in public health outside the capital, that these interconnections are vital. And in fact, that is the advantage of giving more public health responsibilities to local authorities, because it makes it easier to make the interconnections between education and leisure services and environmental health and social care. On the question of sexual health, so you want my speech on sexual health? Well, in a condensed version, I would say this. I think that many of the things that exercise the right-wing press and the tabloid newspapers about teenage pregnancy and young people's aberrant sexual behaviour are really best addressed by better sexual health education in schools, but also better sexual health education which also involves parents in many ways. I have to say this, trying not to be horrible in this speech at all, but the idea that the answer to the sexual health problems faced by our young girls is abstinence classes for girls only, as if only, and it takes girls to have babies, I think is complete and utter nonsense. And it doesn't go anywhere, it doesn't work, and Sarah Palin's daughter, and Sarah Palin is one of the big international proponents of abstinence education, Sarah Palin's daughter who had a child out of wedlock is living proof about where abstinence education gets you. But I think that proper sexual health education is important. If you go and talk to young people around issues of sex and sexual health, you will find there's still too many urban myths floating around, even to the extent that when you say to young girls, why don't they use contraception, they will say stuff like, oh, my boyfriend prefers to go barebacked. Now, number one, as an 80s feminist, why is your boyfriend the defining issue as to whether you risk your own health or not? But secondly, surely you should have better respect for yourself and better understanding than to go along with that. I think better sexual health education is very important. I think on the question of the curriculum, an important question raised about having better health education as part of the national curriculum. I have to say that Michael Gove, who I don't disagree with on everything, I have to say, Michael Gove is allergic to anything in the national curriculum which isn't Latin and the 3 R's, and I suspect you'd do better to speak to him about what's in the national curriculum rather than me.
Very good. We've probably got time for one last round of questions before we close. There's a gentleman with a pen up in the back of that row, and a lady in the second row, and then a gentleman behind her.
Thanks very much, Diane, for a very interesting speech. I'm John Slinger from Quiller Consultants, and I also chair Pragmatic Radicalism, a centre-left policy forum, I guess. I was very interested in what you said right at the beginning about social capital and people, families and individuals not having enough or sufficient social capital to challenge the power of the market. And I'd be very interested in your thoughts expanding on that a little bit, how we can do it without becoming too nannying, perhaps.
Hello, Louise Kirsch from Mind, the mental health charity. I'm really pleased that there's been so much focus on mental health today. But we have been going around the country for the last couple of years speaking to public health professionals, and I'd have to say that by and large, quite a lot of them don't really see mental health as their issue. They understand the smoking and the obesity and the drinks and drugs, but mental health is kind of seen as a slightly separate thing. And we think that's probably because mental health is always treated on a separate track. We have our own trusts and so on and so forth. I just wondered if you had any ideas on what the government or the Labour Party could do to bring public health professionals on board with this.
Hi, good morning. Dwayne Schultes from Science Business. We've touched on the fiscal aspects of food regulation, but looking at cardiovascular disease and diabetes as two huge public health issues, what would be your opinion of mandating exercise or looking at some sort of regulation for people in treatment who are at risk?
Interesting, very interesting question to end on.
Well, on the question of mandating exercise, no power on earth could mandate me to dress up in a pink leotard and go and take classes in front of much skinnier people. But, I mean, I think there's a limit to what mandates can do. But I do think that those places and programs where GPs have made exercise part of the prescription, where local authorities have been able to make free access to leisure services part of what GPs are able to mandate, that has proved very important. And I say about the cost of that, what I say about the cost of many of these things, that you save money further down the road by encouraging an active lifestyle at a very early stage, either in someone's life or in an early stage of some of these long-term conditions like diabetes. On the separateness of mental health, Andy Burnham gives a very good speech about this and says how part of what symbolised the separateness of mental health was the fact that for very many years, right up until the 80s really, mental health hospitals were traditionally these old Victorian buildings on the edge of cities. They were physically very separate from your main general hospitals, your hospitals that catered for the general population. I agree with you when you say that mental health is often seen as separate by public health professionals, but there's a reason why children and mental health was the first issue related to children and public health that I raised in my speech, and there's a reason that when last year I had a whole series of roundtables around public health issues, the first roundtable I held was on mental health. I am determined that what I do, what the Labour Party does around public health, brings mental health together with the other public health specialities and encourages professionals to think in that way. I can assure you that Andy Burnham's commitment and my commitment is to make mental health much more mainstream for general public health and health practitioners than it's been in the past, because we think that's so important. The final question is about And in a sense, it's this, one of the questions which underlie my speech, which is about social capital and what do you do about people that lack social capital in order, say, to go on the computer and find the information. Because Andrew Lansley is very keen on saying he's giving out more statistics, more information, more flow diagrams, more graphs about, you know, results in NHS hospitals than ever before. And as I said in my speech, this is all very well. But supposing you're an old age pensioner in Hackney who can scarcely use their mobile phone properly and does not have a computer in their house. Supposing you're a Bengali mother for whom English isn't your first language. Supposing, like many families in communities like mine, you're not actually that literate, not actually that good at disaggregating charts of figures. I mean, what does the, you know, give the consumer the information and they will make the right choices agenda do for you? Nothing. And the danger is not just that you don't do anything for the pensioner, for the Bengali mother, for the disengaged, socially chaotic families. It is that those families fall further and further behind. That is my fear as an East End MP. Not just that we'll have the status quo, but that certain sorts of families will fall further behind on public health issues. I think there are things we can do in schools, even within the financial constraints, as I say, to bring parents in, to encourage parents. And I've seen it in schools in Hackney, where parents come in and learn to use a computer in the classroom after school. There are schools in Hackney which run classes. They don't literally call them that, but they are classes that teach children how to play with their children. They bring the mothers or the carers in, they give them a game and an activity, they let them go away for an hour to do it, and they come back and they all talk together about what they've done. I think there are things we can do in schools. I think there are things we can do, and this will resonate with some members of the audience I know, working through the church. Working through churches. It is a fact that in Hackney, more people on a weekend go to their church, their mosque, their temple on one weekend than attend a Labour Party meeting in an entire year. So if we're talking about reaching excluded communities, the Labour Party has to overcome what was a history of perhaps squeamishness about dealing with faith groups, other than asking them if they're voted election time, because they will be, in times of constrained resources, the most effective way of getting out messages, whether it's on public health, whether it's on HIV, whether it's on a whole range of social issues. They will be the most effective way of reaching certain communities in our inner cities. So I think schools, I think working with faith groups, but above all, you know, we must always remember when we're talking about health, and we're talking about public health in particular, that it shouldn't just be about the people with the most social capital, the people who are able to shout loudest. What I always say about this, and people have heard me speak about this before, will have heard this anecdote, was that if all I did when it came to antenatal care, if all I did when it comes to antenatal care is listen to the people that write to me, that email me, that come up to me at drinks parties, that set up groups about antenatal care, if all I did was listen to them, I would believe that the most important antenatal issue in Hackney was for middle-class women to have babies standing up underwater to music. But in fact, because I've been the MP for over 20 years, I know the pressing antenatal need in Hackney is underage girls who don't go near antenatal services and end up having underweight babies with a very poor educational prognosis going forward. And actually, because they have to have expensive care at the point of birth, cost the taxpayer thousands of pounds. And so I suppose what I would leave you all with is this. I'm trying to break new ground for the left and the Labour Party. I'm trying to take part take back a debate was actually traditionally the debate of the left in the Victorian era. It was left-wing social philanthropists which went into inner city communities and mapped what was happening to families and set up projects and did work to help families in the slums of Victorian England. I want to retake issues to do with families and communities for the left in politics. I want to put families and children at the heart of our public health policy. And I also want to continue to do what I've done all my political life, is to speak up for people that don't come to meetings like this, to speak up for people that may not even vote, speak up for people that have nobody else to speak for them. Thank you very much.
Thank you, Dan. As ever, it's always a pleasure to hear you speak. It's always kind of refreshing and different, and you hear some things you wouldn't hear from most politicians. We had John Cruddas here a while back, now Chair of Labour's Policy Review, talking about blue Labour, and a lot of the things he was talking about I felt were coming up in your speech too. It's interesting how some of these points kind of cross across left and right. There are certain people on the right, I'm sure, would agree with you about a lot of what you said about the family and social capital. So, very interesting stuff. Thank you again. You've given us some wonderful images which will always haunt me. The thought of you in your pink leotard, I think, is, I'm afraid, the thought that is going to stay with me more than anything else. But nonetheless, brilliant stuff. Thank you for being here today.